My name is Dr. Peggy Pennoyer, and I'm a physician in Portland practicing allergy and immunology. Here in Maine, toxic air pollution is impacting our health in significant ways. This pollution is harmful to all of us, but is particularly dangerous to children, seniors, and people with asthma, lung disease, and heart disease. When we talk about soot, we're talking about fine particles in the air that can literally kill. Soot can increase the risk of heart attacks and strokes, worsen asthma, and can increase hospital admissions for respiratory and cardiovascular problems. Smog, also called ozone, can also shorten life. Smog is a colorless, odorless gas formed in the atmosphere from emissions. Smog burns the lungs and airways, causes chest pain and cough, and aggravates asthma, and it increases hospital visits for respiratory problems. Lung disease patients struggle just to breathe every day. For them, unhealthy air days are not just an annoyance, they are immediate threats to their health. So while those warm, sunny days are something that all of us look forward to, especially after a long winter and cold spring, my patients also know from past experience that the hot summer days carry with them a risk to their health. They know that unhealthy air days can force them to increase their medications, to stay indoors, and to restrict their activity. For many of my patients, accurate ozone warnings can mean the difference between a day they must spend indoors and a day that they must spend instead in the doctor's office, emergency room, or even the hospital. That's why it's so important that EPA standards are based on the best science, not the preferences of individual and industrial polluters. My young patients with asthma must spend his time in the nursing office at summer camp rather than out playing capture the flag with his new friends. My elderly patients become further isolated when they must stay indoors away from their friends because of air quality alerts. Let's be clear, unhealthy air affects all of us, many with our health, and all of us in our pocketbooks. That's because health costs are never just about the person affected. Health costs are spread across the system. We all pay the price for every asthma attack, every trip to the emergency room, and every heart attack that is brought about by unhealthy air. No one, adult or child, someone with asthma or someone who doesn't have asthma, should have to retreat indoors to breathe healthy air. And more importantly, no one should be caught unaware, believing the air is safe for them when in fact it's not. Stronger air pollution standards are essential to reducing expensive healthcare costs and helping us all live healthy lives. Northeast policymakers, including Senators Snowe and Collins, play a key role and must stand together to protect the region's children, seniors, and family. Now is not the time for delays, now is the time for leadership. We call on Senators Snowe and Collins to reject all efforts to delay making our air healthier. Maine children and families are counting on you.